Hello everyone, my name is Tang Yinghua, working in the first affiliated hospital of Guangxi University of Chinese Medicine. The title of the case I'm going to present today is 3 blood glucose results in one sample, which is right and which is wrong. On the night shift, when I was reviewing the report on the Heritage 17600 biochemical analyzer, I found an incredible result. The patient's blood glucose was less than 0.5 millimoles per liter, while the patient's historical result from the previous day was 5.4 millimoles per liter. The sample appeared to be in good condition and free of lipid blood, hormolysis, jaundice, and other phenomena. Then I re-examined the sample, and the result was still the same. So I immediately called the ICU to verify the condition and asked about the joint process. The doctor reported that the patient was in a stable condition without hypoglycemic symptoms, and the patient had no history of diabetes and had not been treated with insulin. The nurse confirmed that the process was standardized and there was no problem of blood drawn on the infusion side. So, is this report to be sent out like this? Like most hospitals today, the current methods of blood glucose detection in our laboratory include Heritage 17600, Abbott C16000, and Johnson & Johnson portable blood glucose meter. To resolve the discrepancy, I used the Abbott to test the sample again. The result turned out to be 5.5 millimoles per liter. Then I used the Johnson & Johnson to test the sample, and this time the result rose to 30.8. I was very confused. The 3 results were so different. Which one should I believe? In order to find out the truth, I reviewed all the test results of the patient carefully and found that all the test results today were not much different from yesterday's, except for one value, vitamin C in routine urinalysis results. So I called the clinician again, and the response I got was that the patient was injected with vitamin C today. At this time, the cause of 3 blood glucose results in the same sample was finally found: the interference of vitamin C. However, how could the same interference cause such a big difference? The methods of Heritage, Abbott, and Johnson & Johnson used in our laboratory are all glucose oxidase methods. After reading the corresponding reagents instructions of these 3 instruments, we found that the anti-VC interference ability of reagent produced by different manufacturers is different. The anti-VC interference ability of Abbott was less than or equal to 100 milligrams per deciliter, and the Heritage was less than or equal to 7.5. However, the interference to Johnson & Johnson by vitamin C is exactly the opposite of that of biochemical analyzers, which will always cause positive interference to the test results, and the results will be falsely high. And our instructions for urine dry chemical reagents show that 1+ sign corresponds to a concentration of about 20 milligrams per deciliter. 2+ signs corresponds about 40, and 3+ signs corresponds 70. According to the VC result in the urine of the patient, the VC concentration in the patient was about 40 milligrams per deciliter. Therefore, it can be inferred that among the 3 detection results, 5.5 millimoles per liter accurately reflected the real blood glucose result of the patient. At the same time, in order to verify the degree of interference of VC on blood glucose detection, I conducted the interference verification experiments. From the experimental results, we found that the reagent used by Heritage failed to calculate the recovery rate after the VC concentration exceeded 10 milligrams per deciliter. The reagent used by Abbott would not affect the results when the concentration of VC was within 100 milligrams per deciliter, but the recovery rate would not pass when the concentration of VC exceeded 100 milligrams per deciliter. With the continuous advancement of laboratory testing methods and technologies, clinical laboratory personnel should be aware of the principles and the limitations of these testing methods. When abnormal results occur, we should analyze the possible causes, take the initiative to enter the clinic, communicate with clinicians in time, and look for ideas to solve clinical problems encountered. Thank you.